If you're pregnant, don't take Tylenol.
President Trump and his advisors' unsubstantiated claim about a link between Tylenol and autism has compelled medical groups to counter that statement. Tonight, as many parents may be racking their brains with questions, Wave News reporter Julia Richardson wanted to break down the claims and what local autism advocates are telling mothers who may now feel that they are to blame. Julia.
Jose, at a press conference this week, President Trump claimed there is a link between acetaminophen and autism. The president also encouraged pregnant women not to take Tylenol. But autism advocates say those statements without strong medical research to back it up can be harmful to those working towards solutions for those impacted by autism.
Instead of looking for what caused it, then you look for how you can help families.
Rebecca Thompson is part of the Autism Society of Kentuckiana. The nonprofit organization provides support for families affected by autism spectrum disorders. Thompson also has a son who is autistic and tells me she's used to hearing unfounded claims about autism. So when President Trump made this statement Monday,
So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Thompson wasn't surprised.
Back in the 60s, they called us refrigerator moms. They tried to blame the moms back then. So it's like it's come full circle and they're trying to blame the parents again.
Since President Trump's announcement, several research organizations and medical professionals have said there is no consistent link between autism and acetaminophen. These include the Autism Research Institute, the World Health Organization, and the American Academy of Pediatrics.
The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism.
A former director of the Centers for Disease Control and Prevention also weighed in, saying Health Secretary Robert F. Kennedy has been behind multiple false claims.
I'm concerned that the only person who the president is listening to is Secretary Kennedy, who has a long history of mis and disinformation.
Those with autistic family members like Thompson say blaming people for conditions like autism takes away from actually finding solutions.
They want to find a reason for it other than, actual research. You can't blame people because you really don't know what causes it.
I reached out to some other organizations in the Louisville Metro that I either did not hear back from or was told did not want to comment. Norton Healthcare says they encourage pregnant women to talk to their doctors before taking any kind of medication. Julia Richardson, Wave News.
Julia, thank you.